opinions of caregivers and women with CF towards pregnancy and CF, to analyze the relationship between the severity of disease and the decision to become pregnant, and to determine the relationship between religious values and considering the clinical status of the patient. It was done by an anonymous questionnaire in Israel to female patients older than 18 years, and it was given to caregivers at all 6 CFN centers in Israel. The first question was, CF patients with lung function of 90% FEV1 should not become pregnant, but achieve motherhood through other means. And you can see that there is no difference between caregivers and patients. But when the question was, CF patients with lung function of 30% of FEV1 should not become pregnant, but achieve motherhood through other means, you can see that there is a statistically significant difference between caregivers and patients. I will terminate the pregnancy if it endangers my life. You can see it's a very, very difference between non-religious and religious people. The well-being of the fetus takes precedence over the well-being of the mother, and again, it's a very big difference between caregivers and patients that don't consider that the fetus is before the well-being of the mother. So the conclusions of our study show that caregivers consider the severity of disease to be a more significant limiting factor in pregnancy than do patients. Patients and caregivers agree that with normal and functional pregnancy is a normal option, and caregivers, in contrast to patients, prefer